Good afternoon, and welcome to today's webinar, When the Brain Changes, Understanding Behavior After an Injury. Thank you for joining us. My name is Katie Law, and I'm a Public Education Coordinator at the Brain Injury Alliance of New Jersey. The Alliance is a nonprofit organization with a mission to provide education, awareness, prevention strategies, advocacy, and support for those who have been affected by brain injury. I would like to announce that we will be hosting another webinar on December 16th at 5:30 on holiday communication strategies after a brain injury. You can find more information about this webinar on our website. A few housekeeping items before we get started. Attendees' microphones have been muted. If you have any questions during today's webinar, please type them in the Q&A box. We will get to as many questions as we can at the end of the presentation. The webinar is being recorded and will be available for viewing on the BIANJ website. At the end of the webinar, a link for a post-webinar survey will be placed in the chat. We value your feedback, so you are encouraged to complete the survey. You must complete the survey in order to receive a certificate of attendance. Once you complete the survey, you will automatically receive your certificate of attendance via email. Our presenter for today's webinar is Dr. Cynthia Boyer. Cynthia Boyer is a clinical neuropsychologist with 40 years of experience in neuropsychology and neurorehabilitation. Her professional career has focused on the neuropsychological evaluation, psychological treatment, and cognitive rehabilitation of individuals with acquired and degenerative brain injuries. Dr. Boyer earned her bachelor's degree in psychology from the University of Pennsylvania and her master's and PhD in clinical psychology from the University of Delaware. She has provided clinical services in a variety of settings, ranging from trauma centers to long-term post-acute programs. She previously served as Executive Director of Brain Injury Services for Bancroft and as a medical rehabilitation surveyor for CARF. Currently, Dr. Boyer maintains clinical and consulting practice in neuropsychology, performing clinical neuropsychological evaluations, psychotherapy, and peer reviews. She is affiliated with Eastern Neurodiagnostic Associates in Voorhees, New Jersey, R3 Continuum, and PaxWork Comp PsychNet. In addition to her clinical work, Dr. Boyer holds adjunct faculty positions at Philadelphia College of Osteopathic Medicine and serves on the board of the New Jersey Brain Injury Alliance. I am pleased to welcome Dr. Boyer.
Good afternoon, everyone. It's a pleasure to be with you, and thank you, Katie. So we're going to be talking today about understanding behavior after brain injury. It's a very complex topic, and we will be looking at how it influences individuals. So as you all know, a brain injury affects everything. The brain controls everything we do, everything we perceive, everything we think, everything we feel. So when the brain is injured, all of those things can change, and they change in a split second. So it's not like the individual has any time to prepare for the changes. It just happens. So when we think about the impact of changes, we need to think about a couple of things. So we're going to kind of talk in generalities today because there is a wide range of influence that can happen when the brain is injured. It can range from a very subtle injury, very subtle changes to cognition and perhaps personality, to profound changes in cognition, motor skills, and behavior, and everything in between. And when you think about brain injury, there's an old saying in rehab, and I can say this because I've been around a long time. When you've seen one brain injury, you've seen one brain injury. Every brain is different. every brain injury is different. And everyone brings different life experience, different capabilities to the table so that when the brain is injured, the results can be different. Go ahead, Katie. Okay. So this is kind of one of my favorite quotes about brain injury. And I think it really kind of pulls everything together in terms of how you want to think about it. So imagine waking up each day with a pounding headache, always feeling like you have a hangover, plus a bad flu after being up 3 nights in a row, having trouble concentrating, remembering, and getting your thoughts together, losing your temper, and snapping at people for no good reason. On top of that, nobody believes you or thinks that you're crazy. So that's just one perspective, obviously. But with brain injury, particularly with the milder end, when you look at someone, you cannot see that there's an injury there. With more severe injuries, obviously, you can see that. You can go ahead, Katie. Okay. So let's talk a little bit about how common emotional and behavioral changes are after brain injury. And I have to tell you that the statistics here are wild. So when you look at depression, which is probably the most common mood change after brain injury, the statistics range from 20% to 60%. It's most common actually after more mild injuries for people to experience depression. And it's more common for it to occur actually later on in the injury. With anxiety, there's also a pretty good range, not as big as with depression, but it ranges from 1% to about 30% of individuals. And then the most common emotional behavior change after brain injury is irritability. And the estimates are that up to 70% of people who have experienced a brain injury experience irritability after the brain injury. So you can see that these emotional behavioral changes occur very frequently with people. And they're not mutually exclusive either. Someone can have both irritability and depression, or both depression and anxiety, or any combination of the three. Okay. All right. So when we talk about the underlying cause of changes in behavior, there are several different categories, and each of them have several subcategories. So we're going to talk a little bit about kind of physical changes to the brain, neurochemical changes, reaction, and that's a psychological reaction, and then environmental factors. Most likely for most people, it's not one of these. Most likely it's some combination of these factors and kind of the sub-factors that are underneath them. Okay. So one of the most common, and probably the most common cause of behavioral problems is physical injury to the brain. So where the brain is injured. And the most common cause of behavioral problems, the most common site is the frontal lobe. The frontal lobe is connected to the limbic system, and it's those connections that can be disrupted. So the frontal lobe itself can be injured, and it's where it sounds like it's in the front of your head, your forehead. So it's very commonly injured in motor vehicle accidents, in falls, in assaults, in the most common mechanical brain injuries. Go ahead. So when you think about the frontal lobe, I kind of like this slide because it divides things into the thinking part of the brain, which is the frontal lobe, and then the emotional part of the brain, which is the limbic system. When you think about the frontal lobe, one way to think about it is it's responsible for starting and stopping behaviors. So damage to the frontal lobe, even though it kind of sounds contradictory because they're kind of polar opposites, can cause either too much of something or too little of something. So some of you may be familiar with lobotomies that they performed back, I think, in the 1950s, before we had good ways of treating psychological conditions. And what they did in a lobotomy is they actually went in through the eye socket and just wiggled this thing that looked like a crochet hook around and destroyed part of the frontal lobe. And what that did was it stopped behaviors. So we know that that part of the frontal lobe is where stopping behavior starts. That's the orbital frontal region, it's called orbital eye, frontal lobes. The dorsolateral part of the frontal lobe, which is a little bit higher up, is more where the kind of impulsive, disruptive, not thinking types of behaviors are controlled. And the way that was discovered was actually in the 1800s through somebody who was injured on the railroad. A railroad spike went into his head, and they followed him over time. And that's when we first knew about kind of what frontal lobes do. So they start behavior, they stop behavior. The limbic system is our kind of emotional control center. And there are various tracts and fibers that connect the limbic system to the frontal lobe. So usually there's not physical damage to the organs in the limbic system, the thalamus, the hypothalamus, the amygdala, the hippocampus. They're usually not physically damaged, although they can be. More often than not, it's the connections between the frontal lobe and the limbic system that is affected, and that's what causes some of the behavioral problems that we're going to talk about. Okay. And then you have neurochemical alterations. And we have become more aware of these more recently. And I'm actually going to go kind of in kind of a different order here than I have them on the slide. So dysautonomia, and I'm going to tell you, I'm going to do this kind of at a very superficial level. I'm not a physician, and you could probably do a whole hour presentation on each one of these. But at least going over the basics will help you understand how these conditions contribute to behavior problems. Okay. And the way to think about it is when the brain functions, we have neurons in the brain, and we rely on those neurons to communicate with each other. When there's a brain injury, those neurons are stretched and torn, and they're not able to communicate with each other in the way that they need to. And that's what causes these neurochemical alterations. So back to dysautonomia. So many of you probably know about the autonomic nervous system. It's kind of, when you think about autonomic, it's like automatic. It's the part of the nervous system that does things without us kind of thinking about it. It controls breathing, digestion, heart rate, all of those things that our body does that we don't have to think about doing. And it's divided into two different systems, the sympathetic system and the parasympathetic system. The sympathetic system is what we think about when we think about kind of fight or flight types of problems. So in fight or flight, your nervous system gets all revved up, you kind of breathe more rapidly, your heart goes faster, you start to sweat, those types of things. That's the sympathetic nervous system. In the parasympathetic nervous system, it's the opposite. That's kind of the slowdown part of the autonomic nervous system. So that helps you relax, it decreases your heart rate, it makes you kind of feel more comfortable, more calm. What can happen in a brain injury is the chemical connections between the carriers for the autonomic nervous system are disrupted. So they don't get the right messages. So normally they're kind of balanced between how much the sympathetic nervous system is working, how much the parasympathetic nervous system is working. In a brain injury, that balance is disturbed, and one of them may work more harder and more often than the other. And it can result in a whole bunch of different types of symptoms. So if you think about what I said a little bit earlier about what the autonomic nervous system controls, if it's disrupted, it can cause problems in heart rate, it can cause fatigue, it can cause chest pain, it can cause mood problems, it can cause kind of brain fogginess. Almost any type of symptom that you can think of can be caused by this dysautonomia. And it can be a very difficult condition to diagnose because the symptoms are kind of vague and kind of general, and they can be attributed to many physical conditions. So it can take a while until this is diagnosed, but this can happen after a brain injury. You can also have something, and this is kind of, again, something that is a newer discovery in terms of kind of neurochemical alterations, is what's called disrupted neurovascular coupling, which is kind of a mouthful. And what that is the balance between the energy that the brain needs. So blood brings energy to the brain. So the balance between the energy that the brain needs versus what it's getting. And in brain injury, because of the damage to the neurons, this can be disrupted. So what that means is some areas of the brain get the energy that they need, and other areas of the brain don't get enough energy. So in that case, what can happen is the area of the brain that's getting the energy overfunctions to make up for what's not happening. And that causes things like fatigue, irritability, and some cognitive problems as well. That is often diagnosed with fMRI. You can see where the blood is flowing, and you're able to diagnose it that way. But when you talk to individuals with brain injuries, fatigue is a very common problem, and this may be kind of what one of the root causes is of fatigue. And then the last two are decreased neurotransmitters and hormone dysfunction. And again, it's related to this dysfunction of the neurons. Usually in both of these cases, you're getting less of the neurotransmitters and less of the hormones. So hormones, as you may or may not know, are distributed in the blood system by the endocrine system. They work kind of slowly, and they're distributed primarily by the pituitary gland and the hypothalamus. And there's actually a condition, and I'm going to read the name of it because it's kind of a mouthful, called post-traumatic pituitary-hypothyroidism. And that happens because of the disruption in the distribution of the hormones. And that is easily disrupted because of the type of physical structure of the pituitary gland and the hypothalamus and where they're located. Likewise, decreased neurotransmitters are secreted by the neurons, not by glands in the body. They work more quickly and are distributed more widespread, but they can also be disrupted. And you may get less neurotransmitters, less serotonin, less dopamine, less epinephrine, which can cause difficulty with mood, difficulty with energy. And I have to say here with all of these, if you're kind of following the thread, is that they all kind of are interrelated and can interact with each other. it's probably very rare that you have kind of a single one of these. I think that often they occur in pairs or in triads or honestly all four together. Okay, Katie. Okay. So that's the physical aspect. So the physical aspect is because of the mechanics of the injury. And then you have, can you go, and then you have, can you go back one? Yeah, thank you. And then you have kind of the personal factors, the person's reaction to the injury. And this is where some of the things that I talked about earlier, it's a single brain injury. Those pre-injury factors come into play. How old is the person? What are their capabilities? Do they have any pre-existing conditions? Is it somebody who has ADHD? Is it somebody who already has a depressive disorder or an anxiety disorder? All of those factor into the individual's reaction to the injury. And then there are the aftermath of the injury, which also causes a psychological reaction. And that's the individual's coping skills. This is a very traumatic thing. Having a brain injury is traumatic, whether it's from a traumatic event or an acquired event. It's traumatic to have those changes and have to be able to cope with them. Some individuals have better coping skills than others, so there's less of a reaction. But for individuals who have reduced coping skills, they're going to have a more significant psychological reaction. And then there are factors such as grieving the loss when you have a brain injury, particularly a moderately severe or a severe brain injury. There are losses. There are things that you used to be able to do that you can't do anymore. And there is grief associated with that loss, and there's the grieving process. And that leads to the next partial type of reaction, which is that identity crisis. Who am I now that this happened? I'm not the same person that I was before this injury. Who am I now? How do I cope with that? How do I reconcile what I've lost? And how do I move forward? And all of these individual factors can cause behaviors and behavioral reactions. And then we have what I kind of call environmental and external factors. And these are things like noise and overstimulation. So if you kind of think back to some of those hormonal endocrine factors that I talked about, particularly not having enough energy or the dysautonomia, that makes individuals more sensitive to noise and overstimulation. So you see there's an interaction there. Sleep and fatigue certainly influences behavior. There's a lot of research now about how very important sleep is and how not enough sleep can lead to actual cognitive problems as well as behavioral problems. And if you remember, when we talked about some of the hormonal, endocrine, autonomic types of factors, that can also contribute to poor sleep and fatigue. The other thing that contributes to poor sleep and fatigue can be pain. If somebody's in pain, they don't sleep very well. If somebody's in pain, it can also cause irritability, it can cause depression, it can cause anxiety, it can lead to all of those psychological types of issues that can lead to different behavioral problems. And then medication side effects. Many individuals who have had a brain injury are on some type of medication, whether it's anti-seizure medication, whether it's medication for pain, whether it's medication for other injuries that they sustained in the incident, or even pre-existing medical condition. But as you well know, there's no medication that does not have a side effect. So sometimes one of the first things to think about when you're looking at behavioral problems is what medications is the individual taking, and what are the side effects, and could that possibly be one of the root causes of these behaviors. And then last but not least by any means is substance misuse. Many times when individuals have experienced a loss, don't have very good coping skills, they turn to substances to self-medicate. And also, we know that many individuals who have pre-existing substance abuse problems engage in behaviors that make them more likely to abuse substances. So that substance abuse and substance misuse can also lead to inappropriate behaviors. So we have all of those factors that can interact to cause different types of behavioral problems. Okay. So now that we know what some of the underlying causes are, we're going to talk a little bit about what some of the different types of behavioral problems after a brain injury are, and how these different factors may contribute to these behaviors. And I use the term behavior very broadly. I use it to encompass kind of emotional reactions, cognitive types of skills, a plethora of different types of attributes that the person may have. So I don't use it just, kind of as kind of behavior per se. Okay, Katie, you can advance. All right. So when we think about the primary behavioral and emotional changes after brain injury, cognition and self-awareness issues are one big area. So having limited cognition, having poor memory, having an inability to multitask, having slowed processing, all of those cognitive challenges can lead to behavior problems. If you are not able to process information quickly, you're not able to keep up in a conversation. That may lead to irritability. It may lead to an angry outburst. If you're self-reflective, it may lead to being anxious, knowing that you're not able to do it, and being anxious the fact that you're not able to do it, which then makes it less likely that you're going to be able to do it. There are also, with many individuals, and you probably know this, significant awareness issues. And it's not that the individual is necessarily in psychological denial about their abilities. Part of it is the actual injury to the brain. When the frontal lobes are injured, in addition to stopping and starting behaviors, which is important for what we're talking about today, the frontal lobes also give us our ability to be self-reflective, to stand outside of ourselves and look at what we're able to do versus what we're not able to do. So when an individual doesn't have good self-awareness or quote unquote insight into their abilities, they may do kind of risky things. And those behaviors can cause people who are around them to be more protective, to ask them not to do those types of things, which then kind of leads into this kind of vicious cycle of getting irritated, perhaps getting angry, maybe even getting aggressive, because of that interaction between poor self-awareness and what they are actually trying to do on a daily basis. And again, similar to how we talked about the underlying causes of behavior problems, all of these behavioral and emotional changes are also interconnected as well. So when I talk about impulsivity and poor judgment, that kind of goes together with self-awareness. And it also is the hallmark of frontal lobe injury. So if you remember, frontal lobes are responsible for starting and stopping behaviors. So if you don't have a good stop sign in your frontal lobe, you're going to think about something and you're going to do it. Or you're going to think about something and you're going to say it. And it may get you into a situation where you cause additional injury to yourself. It may alienate you from your coworkers. It may cause you to get fired from your job. It can cause a cascade of different types of problems for the individual that all kind of stems back to that injury to the frontal lobes. Emotional and personality changes. We talked about in the kind of underlying kind of neurochemical changes that happen, how that can lead to individuals having difficulty with stimulation, being more irritable, actually more irritable at the nervous system level as opposed to kind of the behavioral level. So you may see individuals who have this just edginess that they did not have prior to the injury. And it's because of a combination of factors. It relates back to the neurochemical changes, it relates back to the injury, the location of the injury, and it relates back to their psychological reaction to the injury. And all of those contribute to the individual kind of not being themselves or being kind of somebody different and feeling like they've changed, or family members feeling like they've changed, and not being as sensitive to other people, being more egocentric, being more self-centered, not wanting to actually extend themselves. And when we talk, and then kind of last on here is actual psychological and psychiatric changes. And some of these can be related to the part of the brain that's injured. Some of them can be related to the reaction to the injury, and many of them, frankly, are a combination. But as we talked about when we were getting started a little bit earlier, psychological conditions after brain injury are very, very common. Particularly depression is very common after a brain injury, as the individual is coping with their ability to deal with the changes that have happened to them literally overnight. Okay. All right. So back to some of the cognitive problems that can cause behavioral problems. I'm going to use these to give some examples for how they may cause a behavior problem. And I'm going to kind of skip impaired cognition because that really is kind of the others that we're going to kind of look at. So think about memory impairments. And again, as I kind of noted when we were getting started today, this can run the gamut from occasional problems with short-term memory to really profound problems with short-term memory. So for an individual who's not able to remember things that happen from day to day, they can have a couple of different types of behavioral reactions to that. One reaction is to just brush it off. It doesn't matter. It's not important. I really didn't care about that. So kind of covering up in a way. So that's kind of one reaction. Another individual may become really depressed, like, wow, I used to be able to remember that kind of stuff and I can't remember it anymore. that really makes me sad. If I can't remember these things, am I going to be able to work? Am I going to be able to pay my bills? What am I going to be able to do? And that can cause this real kind of downward spiral. Somebody else may just get frustrated and irritated. I should be able to remember that. I don't know why I can't remember that. Maybe it's your fault. Maybe you didn't tell me. And they may get verbally aggressive, even physically aggressive. So the type of cognitive issue interacts with not just the nature of the injury, but it also interacts with the person's personality. So you have this really complex thing that happens. And it's this, you can use the same type of continuum to look at individuals who have problems with problem solving. That's a mouthful. Where they can have a reaction that ranges from anything like, well, you know what, that's not important. I didn't care about it, to, oh my gosh, this is a catastrophe. What am I going to do if I can't do this? And all of these cognitive issues interact with the underlying causes, the underlying physical causes that contribute to the cognitive impairments. Want to go, Katie? Okay. So when we talk about behavioral problems after brain injury, one of the most common and one of the most problematic for individuals is social inappropriateness. And that is definitely caused by injury to the frontal lobes. If you remember, I mentioned that there was a kind of historic case that enlightened individuals about frontal lobes. And it was an individual, name was Phineas Gage, who worked on the railroad. And he had a railroad tie that went up into his forehead and caused injury. And before this, he was just this real kind of mild-mannered, kind of nice guy. After the injury, he was rude and lewd and just totally inappropriate. And that was kind of the beginning of understanding what the frontal lobes do and how they contribute to social inappropriateness. So not only is the individual impulsive, says things without thinking about them, does things without thinking about them, but they're not polite. They're not considering other individuals. They are just blurting out whatever comes to mind. And as I mentioned previously, this can lead to all sorts of problems in their personal life, in their vocational life, and in their everyday functioning. It can even lead to individuals having trouble with the law because they're so inappropriate. And particularly in the time that we live in, you know, it was one thing to be socially inappropriate one-on-one with somebody. But now in the days of social media where somebody can be recorded and it can go all over the place, that social inappropriateness really can be extremely costly in terms of the individual's kind of ability to function in a job and function personally. I think I said enough already about risky behaviors. I'll just kind of say lack of insight and impulsivity and cognitive impairment. It's really the three of those things that interact to cause people doing things that are really high risk. So it's not a single cause. And for most of these things that we're talking about today, there really is a significant interaction between numerous factors. Okay. Okay. So when we talk about emotional and personality changes, I think we're getting kind of close to time, so I'm going to go a little quickly here. The types of things that we're talking about are irritability and aggression, and I think we've talked about that enough. But the flip side of that is that apathy and lack of motivation. And I just want to make the point here that many times that apathy and lack of motivation is misunderstood as depression. Remember when we talked about the orbital frontal section of the frontal lobes and how that really leads to lack of initiation, lack of ability to get started. So many times that lack of motivation and apathy is not necessarily related to depression, it's related to that physical injury to the brain. And then also some of the hormonal factors that hormonal and neurotransmitter and autonomic factors that can lead to fatigue can also contribute to that. I just want to say briefly with emotional lability, that's another whole presentation. Um, but there are certain types of conditions after a brain injury that lead to emotional lability. Pseudobulbar condition is one of them that can cause just difficulty controlling emotions. And again, it's kind of related to that frontal lobe stopping and starting. The emotions just kind of well up and the individual really can't control them. Okay. Okay. So I think we've talked about this enough. So depression most common, anxiety second most common. There is some PTSD following brain injury. Typically that's for the milder injuries. With the more severe incident, so if you don't remember the incident, it's pretty difficult to have PTSD. But depression common, anxiety kind of second after that. Okay. All right. So to kind of put this all together, when you think about what happens after a brain injury, there are many changes that the individual has to cope with. The changes in their abilities that lead to changes in their identity. We're often very tied to our careers, what we do for work, how we work. When that changes, that is a drastic change for the individual and really kind of affects their ability to function. With those changes, there can also be changes in roles and relationships. Sometimes the breadwinner is no longer the breadwinner. Sometimes there's a significant change in the individual's ability to take care of themselves. So they're no longer a caregiver, they're a care recipient. And all of this, the individual really needs to accommodate to and be able to accept. And that can lead to those behavior changes that we have been talking about during this hour. The irritability, the aggression, the depression, the anxiety, all of these things can happen after a brain injury. Okay. Okay. And this is just kind of a quote that I like, that kind of speaks to the factors that we were just kind of talking about. And that's why depression usually happens a little bit delayed after a brain injury. In the beginning, people really have this hope that they're going to recover, and they're okay because they still have this hope that they're going to recover. But as time goes on and it becomes more clear that they are at a new kind of new normal, then some of the emotional reactive types of emotions come into play. Okay. So the takeaway that I hope that you come home with today is that the underlying causes of changes in behavior are very complex. It's not usually just a single thing. It's many things. And because every brain injury is unique, and because every person with a brain injury is unique, you may see any combination of these different types of changes in behavior. And there's no kind of one-to-one correlation that, if you have this, this is going to happen. It may be more likely, if you have a frontal lobe problem, you're going to be impulsive, but it doesn't always happen. Remember, every brain's different, every brain injury is different. So it's very individualized and a very complex interaction of physical, hormonal, nervous system, reaction, environment. So what can we do about it? Um, I'm a clinician at heart, and even when I do evaluations, I can't help myself but make recommendations about like what do you do when this happens. Uh, one of and I'm going to kind of go through these things a little bit quickly, but there are certainly things that you can do to treat the symptoms. There's not a whole lot that you can do to treat the underlying causes because the damage has already taken place. So what you want to focus on is how do you manage the symptoms? So one thing that is important is to identify what are the triggers for the behavior, what causes the behavior. Some of you may know what ABC means. Antecedent, what happens before, behavior, what's the behavior, and then consequence, what happens afterward, because sometimes we inadvertently reinforce inappropriate behaviors. So you want to look at if you can identify the triggers. And if you can, then sometimes you can change the triggers. So if overstimulation is a trigger, maybe there's something you can do to reduce stimulation. If I'm going to kind of go into the next one, if poor sleep is a trigger, then you work on sleep and increasing sleep. So having good kind of habits, good sleep, good nutrition, good hydration is really important and can help counteract some of those changes that take place in the nervous system that you really can't kind of fix, but you can ameliorate somewhat. Psychological counseling is good for obviously the more significant emotional reactions people have, more significant depression, more significant anxiety, perhaps anger management. And if you remember, I said irritability is the most common behavior that takes place after a brain injury. So looking at different types of therapies that can decrease irritability, mindfulness, pet therapy, art therapy, dance therapy, your kind of more non-traditional approaches to dampening down that high level of irritability that people have. Support groups can also be helpful. I'll put a plug in for the Brain Injury Alliance. They have support groups. Sometimes just talking to other people and seeing that, oh, this happens, I'm not crazy, or this happens and I do this, oh, I could probably try that as well. And then I put medication last. Medication can help with some of these conditions, but remember, medication also comes with side effects. So you need to kind of weigh the advantages of using medication versus the possible disadvantages of using medication. So there are things that you can do to manage behaviors. You will never be able, probably, particularly in the more severe cases, to completely eliminate them. And that's really not the goal. The goal is to be able to manage them and to be able to manage them to a degree that they don't interfere with the individual's ability to have relationships, to be able to work if they're working, so that they don't interfere, go ahead, they don't interfere with the individual's ability to function. So that was a very broad overview with a lot of information. As I said, for many of these topics, you could almost do a full webinar on each of them. But I think it gives you an idea of the underlying causes of behavior problems, the complexity of the underlying causes, and what those behaviors are, and a little bit about what you can do about them. So I just want to say one quick thing about the image here. This was actually stained glass that was made by a patient of mine who was injured, and he was an artist. He worked at Wheaton Village back when Wheaton Village did a lot of glass, and was actually injured on his way to Wheaton Village. And this was his depiction of what a brain injury was, where, there is an injury, but there's always hope after the injury. And I really like it. So thank you for your attention. And if there are any questions, we can do the questions.
Great. Thank you so much, Dr. Boyer. That was such an informative presentation. We do have a few questions, some
Mhm.
compliments on how rewarding it is to hear that, they hate being called weird or not being truthful. But the main question here is how can we make this more public to schools, law enforcement, and even maybe on TV or ads?
Yeah, that's a great question, and I think that is actually part of the mission of the Brain Injury Alliance of New Jersey and the various brain injury alliances throughout the country. I know that many schools have training, in-service training, and I know that the Brain Injury Alliance provides training in schools. I think that certainly being able to have people know more about brain injuries is the key to this, to really educate people and have people be open to being educated about it and not just contributing it to, as you said, they're weird, they're crazy, they're this, whatever. But education is the key, and then the question is, how do you get that education out? And that is exactly what the mission of the Brain Injury Alliance is.
Okay, and so after a TBI, when does the patient achieve the new baseline?
It's another great question. So after either a TBI and even an ABI, the most rapid recovery takes place early on, so maybe the first 3 to 6 months. But what we know is that recovery takes place for at least the first year, maybe a year and a half, maybe 2 years. So I think once you get to that 2 year marker, that's probably where you're going to be. But we don't really know. So I never say never. It's kind of like this is where you are now. But I think once you get to that 2 year marker, if there are going to be changes, they're going to be more subtle, more small changes versus the dramatic changes you may see in the beginning. If it's a young person, a child, they change and recover as they're growing. So the answer to that is completely different, and that really takes place until the child's a young adult into their mid 20s.
Okay, good. Um, Biggest concern was how long it took to return to the quote unquote normal when the stress of life and understanding. So really that's just a comment, something you had spoken to. Another question here is not what is your view on football injured young people? I don't know if you have any expertise there.
I don't have any expertise, and I have mixed feelings about this because I'm a big football fan. I think what we have been moving to is more non-contact type of football when individuals are young. And I'm talking like elementary school, middle school. Um, I also think that we have become much more cognizant of detecting when an individual has an injury and pulling them out so that there's not another injury on top of that. The helmet technology is getting better and better and better so that it can detect injuries that are not visible to the naked eye. So I think there's a lot of technology out there, and I think it's a really individual decision. But I would kind of say that prior to junior high school, try and kind of do the non-contact types of things if you can.
All right, maybe we have time for at least one or two.
Mhm.
Could a student with potential underlying mental health issues experience an increase in symptoms following a traumatic brain injury?
Oh, yes, absolutely. And that goes back to the type of brain that's injured. So if someone has a pre-existing ADHD, and you have a brain injury on top of that, and I just picked ADHD because that's the most common, it's going to make the ADHD worse. If somebody has a depressive disorder, it kind of depends. Sometimes it makes it worse. Believe it or not, depending on the type of injury, sometimes it makes it better because the individual's less aware and less reactive. But for the most part, usually when somebody has a pre-existing condition, whether it's a learning type of problem, ADHD, a learning disability, or a psychological problem, it tends to be exacerbated and worsened by the brain injury. Sometimes that's temporary, sometimes it's more permanent.
Okay. Yeah. And we have some questions here about getting your email. And the recording will be available for those asking that. Excellent
Uh-huh.
presentation. Got some good feedback here. Thanking you for your time. Very insightful. Um, so I think we covered just about all of the questions and we're just about out of time. So thank you again for sharing your expertise with us today.
My
If your
pleasure.
question was not answered today, you can email me at KLAW at BIANJ.org, and I will try to facilitate the answer with our presenter. One final reminder to please complete the post-webinar survey. The link can be found in the chat. You will automatically receive a certificate of attendance via email once you complete that survey. Um, Thank you again for attending and for your thoughtful questions and comments. We do hope to see you all on the December 16th webinar. And this concludes our webinar for today. Thank you.